Good afternoon. My name is Mark Ereth, and I'm from the United States. I'm very happy to be here on behalf of my co-authors presenting data on active particle control versus ultraviolet C in an active health club. We'd like to thank the organizers of Indoor Air 2022 for inviting us to present and participate in this exciting meeting here in Finland. As a species, as humanity, we are certainly very dependent upon clean water, clean food, and clean air. In fact, water security was not around until the mid-1800s or thereabouts, when we started to see advancement of water purification within communities. And it wasn't until 1910 or so that the United States even had a community that had continuous water purification provided for all of its citizens. We then also think about food security, and many of us are well aware of E. coli and salmonella outbreaks. We certainly have some today. Those are many times the source, whereas home refrigeration, which was introduced in 1927, provided for preservation of food within the home. And certainly it was around the 1940s when the vast majority of households in America anyway had refrigeration, so once the food got home we could then have it preserved. So we've kind of cracked the solutions on food security and water security, but the pandemic has really reminded us that air security is our next challenge. We may not share the same food or the same water, but we all end up sharing the same air. I think of air purification as an actual investment in your health. And remember that you may not be able to control the air where you or your family breathe all the time, but you can in fact deliver clean air within your home, within exercising environments perhaps, or perhaps within your work site. The other thing is that Stanford researchers just this last 6 months identified the fact that wildfire smoke, when that exposure is provided to pregnant women, that the babies, once they are born, they have inhibition of their immune system. They also have pulmonary dysfunction. We know that children with asthma or other types of pulmonary diseases will then also have episodes triggered by wildfire smoke. And so all of these things remind us that today more than ever, air security is critical. And certainly that's the substance of the meeting that we're at today. I'd like to discuss with you the mechanism of active particle control, which is part of our study. First of all, this system is a high-frequency electronic-based system that provides for conditioning of all particles, whether they're volatile organic compounds, PFAS perhaps, certainly particulate pollution, whether it's a 0.3 micron or a 2.5 micron, and certainly all viruses and bacteria. So it's conditioning these particles. It's then allowing them to coagulate and agglomerate with each other as they're conditioned. They attract each other, they gain mass, are certainly then carried to the filter media where they're collected. In the midst of that ultra high voltage electrical field, they are then oxidized, and that oxidative stress kills any biologic material, and then any of the ultra small particles that make it back out into the field are then helping to collect other particles to bring them back in to the filter media. Active particle control has been shown in peer-reviewed published articles in medical journals to be much better than HEPA filtration in operating rooms. We know that active particle control kills highly resistant organisms such as anthrax. Anthrax bacillus is killed very quickly with this technology. If you can kill anthrax, you can kill basically anything. More recently, we are very proud of a publication in which we studied active particle control in a hospital setting, a 124-bed hospital pediatric facility, over the course of 3 years, 100,000 patient days. We were able to demonstrate that active particle control reduced particulates, reduced microbial load, and then actually, believe it or not, reduced healthcare associated infections by a whopping 45%. Not only was there significant clinical impact, but this also resulted in significant financial impact for the hospital. Here we are to the methods slide for our study today. So we went into a 12,500 square foot health club with an active gymnasium with around 90 individuals exercising at any one time. This was a multi-month long study in which we had a month of baseline measurements, a month of active particle control, a month of a reset month, an interval month with nothing, and then a month of ultraviolet light, ultraviolet C light. Here on this slide, you can see in the left side of the panel, we have the particle counts with before and after installation of the ultraviolet C air purification system. And you can see there's only a 4% reduction in actual particles within the breathing zone space of those individuals exercising. On the right side of the panel, you see a very similar baseline with high particle counts as the baseline, but then once we add the active particle control system, we see around a 70% reduction in mean particle counts. We then went on the left side here to look at ambient mold load. So we sampled for mold spores and mold within the breathing zone space, again, kind of between 3 and 6 feet of height off the floor. And the fresh air intake from outside had no mold. After 21 days with active particle control, there was no mold or spores demonstrated within the space. But in the month where we had ultraviolet C light, after 21 days, there was a significant increase in ambient microbial load, specifically molds. The same is true for bacteria when we examined that. Baseline levels for air that was brought in from outside were significantly eliminated or reduced with active particle control, and the opposite occurred with ultraviolet C light in that breathing zone space. And so in conclusion, in a live healthcare gymnasium with approximately 90 actively exercising members, we were able to show that SecureAire active particle control technology is far superior to ultraviolet light placed within the ductwork and or the control with neither treatment. Again, SecureAire's active particle control system significantly reduced particulates, significantly reduced breathing zone bacteria, and significantly reduced breathing zone mold. Thank you very much. Be happy to answer any questions or feel free to reach out at any time.